Hello, and welcome to the Diocese of Bridgeport 2015 Open Enrollment Presentation. We appreciate you taking the time, as this presentation will go through your 2015 benefits. My name is Neil Garland, Senior Account Manager with Aetna. Also presenting today is Ruben Noguera, Principal from Benefit Planning Services. In today's meeting, we'll go through all aspects of your benefit plan, both medical as well as dental and other options. The first thing we're going to discuss are the changes for 2015. One thing not changing is the medical product, which is the Aetna Choice POS 2. This is Aetna's national network that is seamless across state lines and available in all 50 states. Again, there is no referral needed to see a specialist in this plan, and you have access to Aetna's national network. This is very important. Should you be in Connecticut and need care, let's say in New York City, again, you could do that. You have access to Aetna's network if you're traveling, and again, you are not bound by any state lines. So when we're looking at the changes, it's very important to note that the diocese has not made any changes that have had a negative impact on the plan design. In fact, there are only enhancements. The enhancement is that the out-of-pocket maximum in both plans will now include copays. This means both medical and pharmacy copays will accumulate towards your out-of-pocket maximum. There will still be biometric screenings offered through Quest Labs in 2015, and there will still be options which we'll go through in greater detail to earn incentive credits into your health reimbursement account, or HRA. So we thought it would make sense to look at some of these plan design terminology, and the reason is that, again, we made the statement that copays are now going towards your out-of-pocket maximum. So what does that mean? Well, the copay is a flat dollar pay that you pay for various visits in the POS plan or possibly for pharmacy on the HRA plan. And the out-of-pocket maximum is a safety net. That says once you meet this amount, the plan will pay 100% of the remaining claims. Very important to note that today, copays do not accumulate towards this out-of-pocket maximum. So if I were in the HRA plan and had hit my out-of-pocket maximum, again, I would still be paying a copay if I went to the pharmacy. Going forward, every time I pay a copay in 2015, it's going to go against that out-of-pocket maximum. Once that out-of-pocket maximum is hit, the plan will pay at 100%. So the HRA, or health reimbursement account, is still offered. Again, there are no changes except for the fact when you see in the fourth row, the out-of-pocket max now includes the deductible and all copays, which again is pharmacy copays that are applicable to this plan. Very important to note, you have a base fund amount of $200 if you're an individual, $400 if you're a family, and you have a deductible. That's a flat dollar amount that you pay before the plan begins to pay benefits. The deductible applies to all services with the exception of routine preventive care, which you can see in the fifth row is covered at 100% in Aetna's network with the deductible waived. And pharmacy, you just pay your applicable copay. Again, every time you pay a copay at the pharmacy, it goes towards that out-of-pocket maximum. Once the out-of-pocket maximum has been met, the plan will pay at 100%. This includes your pharmacy benefit. There is a second option called the POS plan option. This plan does have copays as well. It's remaining unchanged. The only actual change is the out-of-pocket max that we spoke about before, that this includes the deductible and all copays. So under this POS plan, what you'll see is that if you went to the PCP or the specialist and had a copay, that's going to go towards that overall out-of-pocket maximum. When you go to the pharmacy on the POS plan and pay your copay, that also goes towards your out-of-pocket maximum. This is a nice enhancement for folks because when you get to that out-of-pocket max, you no longer have a copay for services, be it medical or pharmacy. So both plans have the same pharmaceutical plan, and you simply pay the applicable copay when you go to the pharmacy. You would either pay a $15 copay for a generic drug. You would pay 20% of the drug's cost for a brand drug on Aetna's formulary list. The formulary is available on Aetna.com. Again, you would search for a 3-tiered open formulary. And you paid 40% of the cost for a brand drug that's not on Aetna's formulary. It's important to note a few things. Number one, when you're looking at brand formulary drugs, for instance, 20%, what you see is that on the bottom, there's a maximum that you could pay. So if there were a $1,000 drug, 20% of that would be $200. Well, you would hit your maximum for tier 2 drug, which is $50. So again, important to note that you have a safety net that's in place when you go to the pharmacy. Also important to note is that the diocese continues its Aetna Healthy Actions for Pharmacy program, which simply means there are certain preventive medications for things such as diabetes, hypertension, hyperlipidemia, asthma, where you would simply pay the copay, but if it were a generic drug, there's a certain drugs that are covered at no cost, and if it were a brand drug, you would get a 50% reduction in cost. Again, please contact HR for a complete listing of these drugs, or you can visit Aetna.com and search for, again, the Aetna Healthy Actions for Pharmacy. So we talked about health incentive credits at the beginning. These are available on both plans, both the HRA and the POS plan. In your HRA, health reimbursement account, these monies are available as a fund reward. So if I were to earn, for instance, number one, take or update my health assessment. Again, I can do this via Aetna.com. I would get either a $400 put into my HRA, or if I was in the POS plan, I would get a $400 deductible credit. Again, if you're in the HRA plan and you do earn dollars, you have the ability to bring your fund up to a maximum of $1,000 for an individual and $2,000 for a family. Again, what this means is that if the base fund for an individual is $200, I could earn up to $800 in additional credits so that I get my fund to $1,000. Very important to note, in the HRA plan, any unused fund balances will roll forward to the next year. So again, it does make sense if you're in the HRA plan to take advantage of these incentives. And we'll go through each one in more detail. The first one is to take the health assessment. This starts December 1st, and you have through November 30th to do this. If you've already done your health assessment in the past, you can simply go in and update it. All you need to do is go to Aetna.com and go into your member secure website, Aetna Navigator. Once you're there, you can go and take the health assessment. Important to note, the reward will occur the first Wednesday of the month following when one takes the health assessment. What that means is that if you were to take it in December, it would become available the first Wednesday in January. The second incentive is to get a routine physical. Again, this starts December 1st, and this is, again, the same reward that was in place last year, so it's encouraging members to get that routine annual physical. The reward is earned when the doctor submits a routine physical to Aetna and the claim gets processed. Similar to the health risk assessment, the rewards are processed the first Wednesday of every month. So if a physical was done in January and was processed and paid in that month, the reward would be available on the first Wednesday in February. The third reward is to participate in the Quest biometric screenings. The diocese will have Quest labs on site in 2015 at their health fair, date still to be determined, and there is no cost for employees to have this screening done. The biometric screenings, again, will measure blood pressure, cholesterol, blood glucose levels, and again, it's a nice opportunity to know your numbers, as well as, again, available at no cost to you as an employee. And the last reward is to participate with a registered nurse, and the diocese offers registered nurse support for 40 different conditions, things such as diabetes, hypertension. Again, you can get the full list of programs through your Aetna Navigator member website, or you could actually call and get more information at 1-866-269-4500. Again, if you have the ability to work with a registered nurse, you will earn an incentive. And here are just some of the conditions where a nurse can be accessed. So there is a program called Teledoc. Now, Teledoc was added to the diocese plans beginning on January 1st, 2014, but it's going to be continued to be offered throughout 2015 as well. And Teledoc is actually access to board-certified physicians who have an average of 15 years experience, and it's 24/7 access to these doctors via the phone. You can, if you have a smartphone, you can actually download a Teledoc app, and you can FaceTime, video conference, but you have 24/7 access to the doctors. And these doctors have the ability to send scripts electronically. The cost of a visit is $40. Now that goes through as a claim. So again, if you're in your deductible phase, that flat dollar amount you pay before the plan pays benefits, again, it would be $40 that would lower your deductible or be paid by your health fund. Again, this goes through as a claim for you. So you can utilize this service. It's an excellent service. You can visit teladoc.com/Aetna, or you can call for more info. But Teladoc is meant for, again, minor things. You know, you have a child that has an ear infection. You have a known condition such as asthma. But it's a great way, and it's a great peace of mind to know you can visit the doctor 24/7. Again, the average wait time, if you will, you get a call back typically within 20 minutes. You will be working with the doctor. And again, they can send a script electronically if necessary. So we've mentioned Aetna Navigator a few times, and this is probably one of the most important features under your medical plan. And what Aetna Navigator is it's your member secure website. This is, again, secure. It is your site, which means you can look up all your claims. You can see your fund balances in your HRA. If you had a doctor's appointment today, you could actually go in, print off a temporary ID card, and you could order yourself a new set of cards. You can get to everything that Aetna has through Aetna Navigator. It's kind of your central hub as an Aetna member. So very important. Again, it's your member secure website. You can register for this. All you have to go to is Aetna.com, and you can get more information on the Aetna Navigator. One thing available through Aetna Navigator is called the Personal Health Record. The Personal Health Record was something that Aetna developed with physicians, and it will take all of your Aetna's claims data and put it into nice chronological order. You can then choose to add your own information and share it with your doctor. So you have a nice synopsis of your health history. Again, this is something available at no cost. You can share it with the doctor either electronically, or you could print it off if you were traveling or wanted to just hand it to the doctor. It's a great way to, again, keep a record of your health history. There is an app for Aetna. Again, it's free from the App Store if you have a smartphone. And the app has several nice features. For instance, it will show you all the nearest urgent cares that are participating with Aetna within a 10-mile radius of where you're standing. So again, it does all sorts of things. You can pull up your ID card right from your phone. Again, free from the App Store, but please be aware there is an Aetna mobile app. Now, we talked about Teladoc, where that's a cost for that service, and that's 24/7 access to the doctor. Well, there's also this Informed Health Line, which has no cost, and you can speak to a registered nurse. Now, what this will allow is, again, just know 24/7 you can call and talk to a nurse just to run any questions by at no cost. If you have a question and you want some guidance, just know this is a free service. You can put that phone number right into your cell phone if you have one as a registered nurse contact, and 24/7 you could call that nurse and just ask any questions that you'd like. Now, similar to AAA, who leverages their membership to get discounts off other things, such as rental cars, well, Aetna does the same thing. They're going to get discounts off different services just by being an Aetna member. You could get a full list through your Aetna Navigator account, but, for instance, you could get discounts off of fitness, off gym equipment, or Zumba classes. Again, there are several different things that are available. You can access all of these through Navigator. These aren't insurance programs in any way, but these are discounts that you would get just by being an Aetna member. So with that, I'm going to turn it over to Ruben Noguera, the principal from Benefit Planning Services, to guide you through the rest of the presentation.
Hello everyone, this is Ruben Noguera with Benefit Planning Services. There's quite a few topics we're going to talk about with you, starting with one that's near and dear to everyone's heart, and that's the payroll contributions and the out-of-pocket costs to each and every one of you starting in 2015. We're also going to talk a little bit to you about Medicare for those of you who are age 64 or over. We're going to be talking to you about Medicare. That might be a choice you want to consider instead of Aetna. There's also a new benefit program that the diocese is excited to be rolling out to everyone, and that's the Employee Assistance Program, EAP, and I'll be talking about that in more detail in just a minute. Then, of course, we're going to talk about the flexible spending account and the dependent care spending accounts, and we're going to tell you what the meeting schedule is for Q&A sessions in November. We're going to be holding quite a few of those throughout the diocese next month, and then talk to you about next steps. If you are not a high school teacher, these payroll contributions and costs apply to you. You'll notice the current cost for 2014, there's 3 sets of rates here. And in 2015, you'll notice that the diocese is moving to a 4-tier rate system. So you'll have an employee-only rate, an employee plus a spouse rate, an employee plus 1 or more children rate, and then an employee plus family, which means employee, spouse, and children. Rates have not changed very much. You'll see from the single rates and the employee family rates. The 2 other categories are mixed. The second half of the slide, the bottom half of the slide, shows you the annual costs for each of the categories, each of the tiers. And those costs include your deductible, your coinsurance, minus the maximum credit that the diocese allows for the HRA program. That's $1,000 for an individual or $2,000 for a family, plus your payroll deduction. If you are a high school teacher, these are your new rates, your payroll contributions, monthly contributions at the top half of the screen, and your approximate annual maximum cost on the bottom half of the screen. Once again, that maximum cost includes your deductible, your coinsurance, your HRA credit, plus your payroll deduction. As you know, there's 2 health plans that are available to you, the HRA and the point of service plan. We have about a dozen, maybe fewer, employees of the Diocese of Bridgeport that are enrolled in the point of service plan. As you can see from these rates, the payroll contributions and the annual maximum costs are much greater than the HRA plan. So if you're enrolled in the point of service plan rather than the HRA plan, you might want to consider talking to Human Resources and getting your plan switched over to the HRA. It's going to lower your out-of-pocket expenses as you use the plan, and it's certainly going to lower your payroll contributions. The Guardian Dental Plan will continue. It has not changed for 2015, and the contribution rates on a per month basis have not changed much either. But like with the medical plan, we're going from a 3-tiered rating structure to a 4-tier rate structure. These are the new rates for 2015 coming out of your payroll for non-teachers. Here are your Guardian Dental rates for high school teachers, once again on a 4-tier basis. Nearly 200 employees of the Diocese of Bridgeport that are enrolled in the Aetna plan are age 64 or greater, which means you are eligible for Medicare, or you soon will be in 2015. Which means you have another option available to you, and that is Medicare. As you probably know, all of the clergy of the Diocese of Bridgeport who are age 65 to 75 are currently enrolled in a Connecticut Medicare Advantage plan, and as well as many lay employees of the Diocese of Bridgeport. These plans can be as little as $26 per month for a comprehensive medical plan through Medicare, through Connecticut. And we're going to be having a series of meetings next month. If you fall into that category, age 64 plus, we urge you to attend one of these informational sessions where we'll answer all your questions about Medicare, about Medicare Advantage and how they compare to Aetna. So these meetings will be taking place the week of November 17th through various locations throughout the diocese, the high schools, and the Catholic Center. Please make plans to attend one of these sessions and get your questions answered. The diocese is rolling out a new benefit to all employees of the Diocese of Bridgeport starting in 2015, and that's an employee assistance program through ESI. An employee assistance program helps you with many different areas of your life: personal, financial, work, family-related issues. Master level counselors and PhDs will assist you in areas of drug addiction, marital questions, parenting, bankruptcy and financial information, criminal law, supervisor conflicts, employee conflicts, time management, a whole slew of different areas that counselors can be available to you 24/7 telephonically. This program also allows for 3 face-to-face visits with counselors per issue. These are professional advisors. They can also refer you to lawyers, other specialists, adoption advisors, special needs children advisors, geriatric issues for parents, a whole slew of issues that your EAP can assist you on. So you have 24/7, 365-day-a-year access telephonically to master level or doctoral level counselors. ESI EAP has a full access web as well, a website that you'll have access to starting in 2015. You'll be able to log on with ID and password. There's unrestricted telephone counseling available to you. There are up to 3 face visits available to counselors in a nationwide network. And for those face visits, ESI will coordinate with Aetna in case any of those visits are covered by your medical plan. But the first 3 visits are free, no cost to you. Who's covered by the plan? You and each of your family members, dependents are covered, even students away at college up to age 23. The plan covers all full-time diocese employees and part-time employees. Since you'll be talking with the EAP counselors about some personal issues, you can rest assured that all conversations with the EAP are strictly confidential. No one at the diocese will know that you've used the EAP or spoke with any of the counselors. All that information is strictly confidential. The only time that information may be divulged is if there's a threat to yourself or if there's child abuse involved. Other than that, no issues will be discussed with the diocese. Like I said, they have a website, www.theeap.com. You can check out that website now. Starting in January, you'll have a user ID and password where you can go in depth into that website and learn all about the EAP. At our Q&A sessions that we'll be holding next month in November for Aetna, a ESI representative will be available to present to you all aspects of the EAP and to answer your questions about the EAP. The diocese is really excited about rolling out this benefit to all employees of the diocese. Now let's talk about your flexible spending accounts. As you know, there's 3 aspects to it: the premium only, the medical reimbursement, and dependent care reimbursement. What does the FSA allow you to do? It allows you to put away money out of your paycheck on a pre-tax basis to pay for unreimbursed medical, dental, vision expenses. And because that money comes out of your paycheck on a pre-tax basis, the federal government and the state government don't see that money, so you save on your federal income tax, your state income tax, and your FICA tax, which is Social Security Medicare taxes. Let's look at an example of how this would work. Jane Sample, an employee of the Diocese of Bridgeport, earns $40,000 a year. She's in the 25% tax bracket, and she spends $2,500 annually on unreimbursed health care expenses. Without the FSA, Jane is taxed fully on that $40,000 at the 25% level. That's $10,000. So she nets $30,000 in take-home pay, but then she pays $2,500 in health care expenses, deductibles, co-pays, co-insurance, eyeglasses, and so forth. So after that's deducted, her total take-home pay is $27,500. What if Jane had enrolled in the flexible spending account? Well, she's still earning the $40,000, but she's actually putting money back into her pocket, giving herself a pay raise, because that $2,500 that she's already going to spend on healthcare, unreimbursed healthcare expenses, is going to come out of that $40,000 before that money is taxed. So it's going to reduce her tax down to $9,375 annually, giving her a net take-home pay of $28,125 versus $27,500 without the FSA. So she's put $625 into her pocket rather than Uncle Sam's. Now, how do you use the FSA? You're going to choose an amount up to $2,500, okay? You're going to use it for unreimbursed healthcare expenses, and those expenses apply to either yourself, your spouse, and or your children. Some examples of allowable expenses that you can use pre-tax dollars are office visit copay, your co-insurance, your prescription copays, your dental expenses that aren't paid by your insurance, such as your deductible or co-insurance, eye exams and eyeglasses, contact lenses and solutions, and some over-the-counter medications with a physician's prescription only. Some other examples are out-of-pocket expenses for physical therapy, psychotherapy, smoking cessation, acupuncture, vision correction, surgery, and other expenses that are related to treating a medical condition. What isn't allowed to be paid for with pre-tax dollars through the FSA? Here's an example of some of those. Cosmetic procedures and toiletries, maternity clothing. Some important notes to remember about the flexible spending account is that you have immediate access to all the money that you put into it on day one. So if you decide to put away $2,500 for the year, and this comes out of your paycheck on an even distribution over 26 weeks or 24 weeks or however many pay periods you have during the year, obviously on January 1, you're not going to have any money in your account physically. However, all $2,500 is available to you beginning January 1. So it's pre-funded. The use it or lose it provision does apply to the flexible spending account. You have until March 15th of the following year to incur eligible expenses and submit those to my office at Benefit Planning Services. Many of you are familiar with Marianne Pagano. She administers this benefit for us. And in fact, many of you have probably received a letter last month in September stating that you have a certain amount of money still in your account. Make sure you use it by March 15th. Your election is an annual election, and the only way you can avoid that election is with a life event, some life event that changes your status. Otherwise, you're locked into that amount. Services only apply while you're eligible services only apply while you're enrolled in the program. So anything you incurred prior to being enrolled or after your enrollment ends would not be considered a valid and eligible expense. In addition to the FSA, you also have a dependent care FSA, and this allows you to put pre-tax dollars away up to $5,000 a year for the care of a dependent child or an adult in your home who is a legal dependent of you and your spouse. And on this plan, you get reimbursed after you pay your provider, and only the amount that's in your account is actually available to you. So unlike the medical FSA, the dependent care FSA amount is only available to you after you put the money into the account. It's not pre-funded. Some allowable expenses are noted here. Some expenses that are not allowed to be reimbursed under the dependent care arrangement: kindergarten expenses, overnight camps, and non-work related daycare. Some important things to remember about the dependent care account: it's not pre-funded, unlike the medical FSA. You only have access to the amount that's actually in the account. Services must be incurred during the current plan year and prior to reimbursement. The use it or lose it provision does apply to this program. And once again, like with the medical FSA, it's an annual election. The only way you can change that is with some life event change. Here's the 2015 open enrollment Q&A meeting schedule. We have 6 meetings scheduled throughout the diocese the week of November 10th. Please make plans to be at one of these meetings. Review all the material in this presentation. Write down your questions and bring those questions to you to one of the Aetna Q&A sessions or one of the Medicare Q&A sessions that are going to be occurring around the diocese in the month of November. If you are currently enrolled in the FSA, or if you want to get enrolled into the FSA, remember it's an annual election. It's an active, not a passive election. So if you're enrolled now, you still need to re-enroll for 2015. If you're not enrolled now and want to get enrolled for 2015 into the flexible spending account or dependent care accounts, you need to see Human Resources at the Catholic Center, or you can get those enrollment forms at the diocese website. Like I stated before, there are no changes in the dental plan. We're sticking with Guardian. All of your medical, dental, and FSA enrollment or change forms are due into Human Resources no later than November 26, 2014. So make sure you get those things done if you're enrolling or making any changes. You can see Barbara Grassi for those forms, or you can go right onto the diocese website and pull those forms right off the website, print them out, fill them out, and turn them into Human Resources. I want to thank you for viewing today's presentation, and we hope to see you at one of the Q&A sessions in the month of November.